So, good morning guys, welcome back to the channel and another day in the life of an eye surgeon vlog. Today is super exciting, it's my first time back in the operating theatre for the last 2 months. Yeah, thanks COVID. There'll be loads of fun, lots of jokes, and of course, lots of operating. But anyway, let's go right back to the start of the day. So theatre day does mean an earlier than usual start. I get to Marylebone Station for 7 AM, I grab a quick coffee for a much needed caffeine boost, and then make my way over to the Western Eye Hospital. So the first thing I do on theatre days is head up to the changing rooms, dump my bag in my locker and grab my scrubs. After a quick toilet break, it's time to get changed, out of my smart clothes and into scrubs. At 7:30 I meet my registrar and we go through the notes for the patients due to have cataract surgery this morning. A cataract operation involves removing the natural lens from the eye and replacing it with a clear plastic lens, and it's actually the most commonly performed operation in the world. The natural lens in the eye can become cloudy for many reasons. Most commonly this is just the natural aging process, and as the lens becomes more and more cloudy, patients start to experience blurred vision and glare. I go through the risks and benefits for the surgery before the patient signs the consent form. I then go ahead and examine the patient's eye, and after this head up to the operating theatre. So the consultant running the theatre list this morning is one of my favourites, Miss Ameen, and it's a nice relaxed start as we only have 3 patients on the list. We have a quick team brief going over the expected plan for all 3 cases before going to get scrubbed up. During this time, the anaesthetist on the team gives the patient a sub-Tenon's anaesthetic block, which is a small injection in the eye to make sure the eye is completely numb during the operation. After washing our hands, Miss Ameen and I gown up and put on our sterile gloves. It's 8:30 and the patient is now in the operating theatre, and we do a time out. This is one final check to confirm we have the correct patient, the correct eye has been marked and anaesthetised, and the correct lens we are going to implant in the eye has been picked. The first part of the operation is to cover the patient's face with this blue sheet called a drape, and during the entire operation we're talking to the patient, making sure she remains calm and is aware of what's going on. As the eye is so small, the rest of the operation is performed using a microscope. There's a big screen attached to the microscope so the entire theatre team can see what's going on during the operation, and this also really helps when teaching junior doctors like myself. Cataract surgery can be broadly divided into 3 steps. The first step involves making 3 small incisions on the surface of the eye to allow us to get access to the natural lens in the eye. The second step involves using this machine to break up the cataract into smaller pieces that are then swallowed up using a vacuum-like system. And the third and final step shown here involves injecting the artificial plastic lens into the eye, making sure it's sitting in a good position. And that's the end of the operation. It takes 10 to 20 minutes, there are usually no stitches needed, and the patient is awake during the whole operation, but the eye itself is completely painless from the anaesthetic. We cover the eye with a pad and shield, and that stays on for the first day. Almost every patient is super happy after surgery and they're ready to go home after about 30 minutes. Between the morning cases, we chill out in the copy room and we finish the morning list at 12:30, which gives me an hour to take you on my walk around Baker Street while I grab some lunch. And today's lunch is from Wok to Walk, and I'm going with udon noodles with chicken breast and teriyaki sauce. This afternoon I've got a study session, so to consolidate the steps I did this morning in theatre, I head to the wet lab for some extra practice. The wet lab has an eye simulator, which is a virtual reality simulator for cataract surgery, and that's what I'm going to do a bit of this afternoon. It also has an operating microscope, as well as loads of suturing balls and model eyes to allow us to simulate different ophthalmology surgeries. Alright guys, so we're here in the wet lab. We're going to do a little bit of practice using the eye simulator, which is this machine here. And it's pretty cool, we can kind of simulate cataract surgery. Whoa, there we go.
so we can kind of simulate cataract surgery. We kind of, in part of ophthalmology training, we need to do a certain number of modules on the eye simulator before we kind of first operate in the eye. And I think even afterwards, it's quite useful to kind of use the eye simulator. Okay, so I've kind of started up the machine, and this is how it basically looks. So you've got the actual machine here. So it has these eyepieces which work like a microscope. This is exactly what we have in kind of the operating theatre. We have the patient's kind of face with the eye, and you see these little holes over here. These instruments go through those holes, and it comes with 3 different kind of things. It's got these 2 red ones over here and the yellow one. And they kind of work differently, and they're supposed to represent the different tools that we use in cataract surgery. So for example, this one, you've got these bits which squeeze, and you'll see that they're kind of supposed to represent forceps as to kind of squeeze and use forceps in the eye for different steps. Along with all of this, it's got these 2 pedals. So you can see over here, you've got the pedal here, and I'm not sure if you can read, but it's got things like focus and zoom, exactly kind of laid out as you would have when your left-sided foot goes on here. So you'll see if I just slip my shoe off during the operation, I can change the focus, change the zoom. I can move things around using this kind of joystick. And then on the right, we have this pedal, which has 3 positions. Basically, it does different things in position 1, position 2, position 3. And these are really representative of what we actually do in the operating room. So once we've got the machine, we've got the face, we've got the eye over there, we've got the 3 different instruments, we've got the different pedals. The last thing this has, which is really cool, it has a screen. So this kind of shows anyone watching, or I can play back kind of what happens as I'm looking down there over here. So this kind of is a demo video of this particular exercise. So you'll see if I press, tap the image, this is kind of what I'm trying to do. So you're trying to keep your hand as still as possible, move this circle all the way across, and you basically get scored on kind of how fast you go, your tremor, how much movement there is, and you need to get a certain score to move on. And basically it starts off really easy like this, and then gets harder and harder and harder to mimic the actual surgery. So by the end, when you finish all the modules, you're basically doing the entire cataract operation using the simulator. So let's have a go.
Okay, so after about an hour of practice with the eye simulator, I head down to clinic at 2:30 to finish up some admin and go over some portfolio work with Miss Ameen before an early finish for the day. And so that brings us to the end of today's vlog. I hope you found that vaguely interesting and insightful. Hope to catch you in the next one. See you guys.